Hi everyone. As Bina said, I'm Gemma. I work for the Lambeth Early Action Partnership, and I'm going to speak about how we linked data across the programme where there was previously no mechanism for us to do so, and what we've done with that data to evidence outcomes for children and families. There we go. So just a bit about LEAP, which is how we usually refer to Lambeth Early Action Partnership. So LEAP is one of 5 local partnerships that make up A Better Start, and A Better Start is a national 10-year funded programme from the National Lottery Community Funds. We've got 10 years of funding to deliver a test and learn programme that aims to improve the life chances of babies, young children and their families in this collection of local areas across England. And LEAP is the only area with funding in London. So Lambeth is the only borough that received that funding. And we have funded and contributed to more than 20, roughly around 25 local services to meet the needs of families through pregnancy and the early years of childhood. So our age range is up to the 4th birthday of a child. And ultimately, what we aim to do is give thousands of children in our local area, in our community, age 0 to 3, a better start in life. So LEAP is a place-based programme, so we don't cover the entire borough. We cover a particular area selected based on local needs. So we drew on a range of evidence at the beginning of the bid for the funding, and so the local area was selected based on that need, where the evidence illustrated greater inequalities for young children compared to the rest of Lambeth. And what that does is it enables us to kind of compare the differences in outcomes as a result of the targeted services and the kind of targeting of that place-based approach. We're a collective impact initiative, so the services are essentially a holistic suite of services centered around families with young children, and they are designed to link together and work towards shared goals and improve outcomes in 3 key areas: diet and nutrition, communication and language, and social emotional development. And those areas are set out by the funder. So all 5 of the Better Start partnerships do follow that kind of essential foundation. And as mentioned, it's a test and learn approach. So approaches are tested out, data's looked at, and amendments are made and tweaks made, and services kind of progress and adapt, essentially. So this is to describe some of the challenges we had early on in the programme around data and the linkage of data across those suites of services. So we're bringing together data from lots of individual service providers, and those service providers range from NHS trusts, like the large NHS trusts we work with, to local council, voluntary sector organisations. So what that means is there's also quite a range of support that people have, that providers have, in terms of IT, information governance, data maturity, and the systems that they have in place to enable good quality data collection. In the early days, we couldn't link people across services. So, for example, if there was child A in a speech and language service, for example, we didn't know if that was the same child that was in service C for a healthy weight programme. So we didn't know that we couldn't match those individual children or families to understand accurate reach figures first and foremost. So there would have been a lot of duplication in that counting when we reported reach, but also we couldn't develop and design collective evaluation across the programme without that shared identifier to enable kind of cross-identification. Also, the data wasn't standardised, so there were lots of forms and different outcome measures being collected across the range of services, which could lead, a lot of services would be contributing to shared goals, but that wasn't identified in the outcome measures. So there was no read across essentially in any validated tools. So to address the concerns, firstly, we wanted to develop and implement a data integration platform. The foundation of that is a unique key to accurately identify individuals across a range of services and data sets for that kind of unique view of things and reduction of duplication. So this unique key is generated from different pieces of information around an individual, primarily email address, because we identified that that was the one piece of information that every service collected, parent email address. And so that's the primary piece of information. And then there are other bits added to that. So child date of birth, where services collect NHS number, that will be included. And we use an algorithm that pseudonymizes that personal identifiable information it kind of runs across those pieces of information, generates a unique pseudonymized key that also facilitates data sharing because it reduces identification of individuals. When data is uploaded, the platform checks for matches to check if that individual is already in the system with an existing unique key, and if not, creates a new record. And it can also identify families, so we can identify where there are people as part of the same family unit and look at engagement across families. So, for example, if a parent has engaged in a service or a collection of services, whether that then impacts child outcomes. We bring in demographic, locality, engagement and outcomes data then with those matched individuals. And what we've also now done is integrate administrative data sets to the larger population data sets across Lambeth, such as health visiting, maternity and education, so that we can do further analysis, match group analysis and comparison when we investigate those longer term outcomes. So the secondary piece of that puzzle around data solutions is our shared measurement system. The shared measurement system incorporates nested theories of change. So each service has its own theory of change, and that nests within domain and program level theories of change, so that we can look at overall program outcomes as well as the kind of outcomes that each service has delivered upon itself. We've aligned data collection tools and measures across services for consistency, as well as supporting services to be able to do that where they may not have done before. So there's a reduction in burden on practitioners delivering services. And we also have reporting systems for feedback data so that services can learn and improve. That was implemented just over 2 years ago in October 2021. I won't go through this in detail because I know we're trying to keep to time. So this is just a diagrammatic example of our program level theories of change, where you can see each of the different domain outcomes are designed to contribute to the ultimate outcome of improved outcomes for children in the LEAP area. And this table is an example of the shared measurement system for one domain. So domain 1, improved early child health and development. And as you go across the table, it gets more and more detailed. So, for example, a service will collect the outcome measure on the right, and that will contribute we expect those measures to contribute to that ultimate domain. And this diagram is about the data platform itself. So on the left are logos from a number of our service providers at LEAP. Each of those service providers will collect data for the services that they provide, and share that data with us, whether that be in an already pseudonymized format. Some of our services will pseudonymize that data and use that pseudonymization software themselves so that it's already in a pseudonymized format when it comes to us. Some providers will share that in raw form, and we pseudonymize the data when it's uploaded to the platform. So it goes through this process of the data upload, some validation processes, the pseudonymization where data isn't already pseudonymized. Then the system then matches records to matches that data to any existing records, and if nothing's there, that it creates a new record and the database is updated. And then once that process has kind of been completed, it's available for reporting. So in the red boxes are examples of our more routine reporting that data is used for. So program monitoring and reporting, such as those reach figures I talked about and what we report to the funder. We also produce quarterly service reports for every service. They're internal documents for services to receive that data back to them in a kind of summarized and analyzed way, for them to look at their reach, understand if they're meeting particular targets that they want to meet. Narrative reports that don't come through the platform, I don't think, but that all forms kind of a bigger picture that feeds into our annual learning report. This slide is just an example of one of those quarterly service reports. One of the pages, I think they're usually about 8 pages long, just as an example of how we present some of that data back to services. And a bit on our annual learning report. So we're currently working on the latest annual learning report, but this is about our last one in 2021-22. So it's the first program-wide look at our data, and we wouldn't have been able to do that without the data integration and that linkage across the piece. So we looked at data from the start of the program in 2015 to the end of March 2022, analysed demographic characteristics and engagement of LEAP service participants, looked at the feedback data from families and practitioners, and did a piece of analysis around particular outcomes, midterm outcomes of knowledge and confidence for parents, and some of the validated tools of pre and post measures where that was possible. And it focused on 5 domains because this is of that theory of change, because that's where we had the best quality data at the time. And we have quite a lot of planned research outputs making use of the integrated data before the end of the programme. So the integrated data and the shared measurement system coming together to support a range of outputs and pieces of research. So there are 3 levels of evaluation. There's national evaluation, looking across the piece at all 5 of those are better start sites nationally, a local evaluation when we have an evaluation partner, Dartington Service Design Lab, looking across the programme at our impact, and internal monitoring of our more routine monitoring and reporting. We have a kind of work stream at the moment that's about to kick off around collective impact. So we have a combination of projects internally to show how our portfolio of services and ways of working complement and work in combination with one another to make an even greater difference for children and families. So that's where collections of services are expected to impact on particular outcomes, using those population-wide data sets in combination with the service level data to compare engagement and non-engagement against those outcomes. And then we have a number of service level evaluations, some more complete than others and some still in development phase, that we aim to complete before the end of the programme this year. Learning journeys are kind of, rather than doing a full evaluation, it's a descriptive approach to what we've learned throughout the course of a service. And we also support MSc students to develop their research projects, and we had our last batch of reports recently from those master's students from London School of Hygiene and Tropical Medicine. So yeah, I think that's the end. So thank you for listening, and it's just a couple of details there, and hopefully I kept to time.